Great. So hello and thank you everyone for joining us for our 2017 Health Leaders Fellowship Climate and Energy 201 webinar. I'm Mara Herman. I'm the Ecology Center's Health Outreach Coordinator and your moderator for the evening. Before we get started with our presentation, we do have a few housekeeping items to take care of. So we're just going to go through really quickly just some things pertaining to conflict of interest and continuing education credits before I turn it over to our presenters for the evening. So for continuing education credits, this activity was awarded a maximum of 1.5 contact hours by the Michigan Nurses Association for health professionals besides nurses, so registered dietitians, physicians, physician assistants, and other health professionals. A certificate of completion is available, and the certificate will contain the number of education hours. And for participants who are not included in the Health Leaders Fellowship who also wish to receive continuing education credits, you must also fill out the evaluation after the webinar and send an email to myself at mara@ecocenter.org. And there are no known or perceived conflicts of interest for the presenters, planners, or content reviewers of this track. All planners and presenters have filed conflict of interest forms with the Michigan Nurses Association. The learning objectives for tonight are to be able to identify ways in which climate change negatively affects health outcomes and to identify specific problems associated with climate change and health in Michigan and the Midwest region. So I'm very excited to introduce our two presenters for the evening. We are joined by Dr. Linda Rudolph. She is the director of the Center for Climate Change and Health. She has written about climate change impacts on health and the health benefits of climate solutions and has lectured extensively to health professionals about climate change and health. She previously served as Deputy Director for Chronic Disease Prevention and Health Promotion in the California Department of Public Health. In that role, she was the founding chair of the California Health and All Policies Task Force and the California Climate Action Team Public Health Work Group. And Catherine Harrison is the program manager of the Climate Change Champions program at the Center for Climate Change and Health, where she oversees physician training and curriculum development on the topics of climate change, health, and health equity. She has previous experience in health provider education and training, including directing continuing medical education programs. She has formal education and training in health, including climate change and health equity topics, through her BSN in nursing and her MPH. And with that, I'm going to turn it over to our two presenters to take it away.
Okay, hi everyone. This is Catherine Harrison. I'm going to, in a moment, just get our presentation started, but just wanted to say very briefly that we're really happy to be with you all, and we've, as much as possible, crafted this presentation using resources specific to Michigan, although being in California, we also have a lot of information about how climate change is affecting the state of California and also the U.S. more broadly. And we're going to start out, we know you've already had a Climate Change 101 presentation, and so we're going to very briefly talk about climate change and sources and emissions and drivers of climate change and also health inequities, and then we'll dive a little more closely into specific impacts and then also take some time to talk about solutions. So I'm going to get us started here, and Linda is going to kick us off. So I will hand it over to you, Linda.
Great, thanks. Thanks, Catherine, and you can just move on. I do want to just acknowledge that we had funding for the work that we do from Kaiser Permanente and from the Kresge Foundation. Next. And I want to let you know about a resource that you might find helpful called A Physician's Guide to Climate Change, Health, and Equity. Most of what we're going to talk about today you can find in greater detail in this guide, and the guide is available on our website, which I think there's a link to or a website for at the end of the presentation. Next. So as you heard in your first conversation about climate change results from the emissions of greenhouse gases into the atmosphere, and those gases essentially act to trap heat in the Earth's atmosphere and create warming of the Earth's surface and warming of the oceans. Next. And those sources of greenhouse gas emissions really include almost everything that we do as humans in a 21st century industrialized nation. Carbon from our energy systems, which largely still rely on fossil fuels like coal and oil, burning fossil fuels in our home heating systems and using them to drive our cars and trucks, using fossil fuels to make chemicals that we then use in our food systems, like pesticides and herbicides, eating meat because livestock emit a lot of methane, which is a very potent, short-lived climate pollutant, and using all the stuff that we use, all of which requires a lot of currently fossil fuel-based energy to produce. Next. The key impacts of climate change, many of which, but not all of which, are driven by rising temperatures, are changes in the Earth's hydrologic cycle. So we have both more drought and more extreme precipitation and rainfall, rising temperatures with more heat days and more extreme heat events, rising sea levels. In some places we see worse cold waves and worse winter storms as well, and greater intensity in extreme weather events like hurricanes. And then not shown on this map is the impact of the accumulation of carbon dioxide in the world's oceans, which creates ocean acidification that has very adverse impacts on coral reefs that really form the basis for sustaining a lot of aquatic life, and also acidification has impacts on fisheries that we need for food. Next.
Great. Thanks, Linda. And I'm going to take us a little further into some of these impacts that she just briefly highlighted, and also say a little bit about, as we mentioned, the objectives, what's a priority for Michigan. And so we drew from the Michigan Climate and Health Profile Report, as well as the Michigan Climate Adaptation Strategic Plan for 2016 to 21. So these are great resources. I highly recommend that you scope them out if you haven't already. And from that strategic plan, the top impacts that folks are concerned about for the state of Michigan, both in the short term and the long term, are extreme heat events. This includes single days of extreme temperatures, but also heat waves, consecutive days, air quality issues, severe weather, and the impacts that that has on water quality and quantity. And those are the top three short-term impacts that the state is planning for. And then in terms of long-term, concerns around infectious disease, and that includes rising incidence as well as the spread of existing vectors and also new emerging vectors. And then lastly, food safety, security, and supply. So we're going to kind of go through a lot of these impacts and then mention a few other that are still important but don't kind of hit that sort of high priority concern in terms of Michigan's planning efforts. And so just starting off with extreme heat, this is actually a pretty, where most people start with when they think of climate change health impacts, extreme, and for good reason, because extreme heat is the leading cause of weather-related deaths worldwide. But it can also cause complications to chronic illnesses, including cardiovascular and respiratory diseases, and also renal disease. And so we can think of higher risks for MI or myocardial infarction, arrhythmias, asthma attacks, and so on. And part of this is related to the fact that as temperature increases, air quality also worsens, and so there can be this double impact both from heat illness but also air quality impacts as ground level ozone increases and contributes to greater smog, which we'll talk about under air quality. And then it's interesting to note for renal disease, there was new research out last year that has shown a rising incidence of renal disease among people and communities that have no other traditional risk factors for kidney disease. And it's been termed heat stress nephropathy, and is shown to be correlated with areas that are experiencing dramatic changes related to climate change in terms of rising temperatures. Again, this is research that came out last year, and a lot of it was done in and seen among rural communities where there's a lot of agricultural labor, like sugarcane workers in the Caribbean, and then a couple other places around the world. And so we can think of not only increasing the risks of current epidemics, but giving rise to new chronic disease epidemics. And then we can also think of sort of secondary impacts such as on drug interactions and efficacy. We can think of insulin, some psychotropic medications, and some medications used to treat Parkinson's are all impacted by heat. And then risks can run the other way as well. So some medications inhibit our ability to sweat, which can increase our risk for just thermoregulation and heat illness. We'll talk more about crop and livestock loss when we get to food security, but it's just worth mentioning here that extreme heat leads to crop death and disease, as well as livestock loss, and that impacts nutrition, food prices, and food availability. And then we'll also talk about how heat leads to longer, stronger pollen seasons when we discuss allergies. And then I just wanted to note urban heat islands. This is a big equity concern. So these are areas in densely populated urban neighborhoods where the abundance of concrete, asphalt, lack of trees, lack of green spaces contributes to higher temperatures and specifically also higher nighttime temperatures, which are particularly damaging to health. And from an equity standpoint, it's worth noting that one, these areas do not just arise naturally. They're the result of decisions made around land use and planning, and research done out of UC Berkeley, Rachel Morello-Frosch and others have shown that these areas map on to patterns of historical residential segregation. And so low-income communities and communities of color are particularly impacted. From a labor standpoint, we can think of equity, especially in California. We have a lot of folks who are migrant farm workers, and I understand you have some significant populations of those workers in Michigan as well. And you know, we have really great extreme heat labor protections in terms of demanding rest and shade and water for workers. However, the economic incentives to take part in those protections are low because workers are paid on a piece wage. So the more they pick, the more they're paid. And so stopping to rest and have water and sit in the shade they're disincentivized because of the wage structure. So when we think about climate change and health equity solutions, we kind of have to take a really comprehensive look. So that's just one example of that. And then thinking about for Michigan a little more specifically, so these are just a couple of maps showing projected annual number of days above a max temp of 95, and kind of a comprehensive look at the different models and projections shows a 5 to 25 day increase by 2070, although most projections are sort of for the lower bound of that range. And by 2095, Michigan's winters will look more similar to those of southern Ohio, and the summers will look closer to those of mid-Missouri range. So that's kind of what we can expect. And I was just thinking of trying to put that in context, and my son, who is 14 months, will be 78 at that time. So he'll be wanting to be out, hopefully playing with his grandkids and doing things, and I think about how that heat will impact his life. So, okay, so the other really ubiquitous climate change impact that we talk about is worsening air quality, and in part because it's related to so many other climate change impacts. As I mentioned before, higher temperatures, not just extreme heat, but even higher average temperatures creates more ground level ozone, which is a contributor to smog. Also, in California, we are just coming out of a historic 5-year drought, and we've had very dry, dusty conditions across many parts of the state. The drought and the heat has also led to more wildfires in our area, so more particulate matter pollution, as well as the use of chemicals like flame retardants being used to fight those fires leads to more air pollution. And it's worth noting, I won't go deeply into wildfires, but that particle pollution can travel thousands of miles and impact regions and cities quite distant from where the event is actually taking place. And then we also think about indoor air quality issues. Mold from storms and flooding can be a huge issue following severe weather, and even in areas where there's just higher than average precipitation that takes place. And the impacts for air quality are both directly negative, and they impede positive health promoting behaviors. So they can exacerbate asthma, COPD, and other respiratory diseases, but they also limit indoor and outdoor physical activity, which is important, as we know, for our overall health, cardiovascular health, mental health, etc. And then also air quality impacts, particularly those increased ozone levels and smog, can create complications for cardiovascular disease. So lots to think about in terms of air quality, and I know that it's coming out next week, I believe, the State of the Air from the American Lung Association, which is their annual report on ozone levels and particulate matter levels for all the states and most of the counties in the U.S., and they kind of give every state and county a ranking and a letter grade on how they're doing. So that's also worth checking out in terms of air quality issues. And then closely related, allergens are also, we also see longer and stronger pollen seasons as a result of climate change. So the rising annual temperatures and also higher levels of precipitation lead to both increased pollen production and potency. And so across the Midwest, we're seeing higher numbers of frost-free days. And so that leads directly to those longer pollen seasons. And then the actual CO2 emissions in the air are just kind of like superfood for those plants and trees and shrubs, and lead to increased potency. And then linked with again, coming back to those ozone levels, they can increase the sensitivity of the respiratory tract. And in Michigan, from 2001 to 2012, there was a 71% increase in hospital admissions related to allergy diseases directly through asthma complications. And so, you know, allergens, if you suffer from allergies, you already know what kind of issues they can bring in, you know, from quality of life, you know, minor inconveniences to really miserable days, but also more serious impacts for complications with respiratory diseases. Okay, so switching over a little bit to storms and floods, which was another high priority concern for the state of Michigan. Storms, extreme weather is another one of kind of, I think of it as like a poster child for climate change. We think of impacts, we think of Hurricane Katrina, Superstorm Sandy, you know, just the various floods and tropical storms that we see around the world. And really that's a direct result of those hydrological changes that Linda mentioned, and thinking about as the atmosphere warms and can hold more water vapor, when that vapor is eventually released into storms, the precipitation is a lot heavier. And in terms of health impacts, we can think of the direct impacts like injury and death from storms, and vulnerable populations being our emergency responders, our public safety folks, as well as the general public. And we also have to consider more indirect impacts, or you know, secondary, less immediate impacts, such as the mental health effects of that trauma, economic impacts of property loss and displacement, and then all the subsequent physical and mental health effects that that has. Again, we see air quality coming into play from mold, both in extreme weather and storms and floods, but also even in increased average precipitation. And then again, bringing it back to the pollen and the allergy seasons. And then specifically for Michigan, I'll just say a little more about, you know, how this relates to waterborne pathogen exposure, sewer runoff and overflow, and what we need to think about there. So as in many places, storm sewers and wastewater sewers are combined, and most of them are not meant to sustain such heavy overflows. And so when we have these huge storms, they either overflow into streets and yards and parks, and so you kind of have combined storm water and sewage water, or they have to be released into lakes and rivers. And so that is causing a lot of issues. And I think I have it on my next slide. In Michigan, I did find that there was, let me see here, in 2013, I believe it was 190 million gallons of untreated sewage just in April of that year that had to be released into the Detroit and Rouge rivers, and then eventually those waters flowed into Lake Erie, and that year had a pretty significant algal bloom for the lake. In June of that year, another roughly 2 billion gallons of partially treated water was also released. And so being from Minnesota, I deeply appreciate that the Detroit River is one of the best walleye fishing spots in the country, but I don't think I would want to be boating or fishing or thinking about the risks of kind of that runoff into the river. And so thinking about waterborne pathogens and risks for folks and children that are using the river for recreation. In terms of what's projected for Michigan, it's about a 40% increase by mid-century for the north and 10% in the south of 1 inch or more of precipitation, which is considered extreme precipitation for the state. Another thing that might not come to mind intuitively as even a secondary result is that we have these extreme storms and there are significant power outages, and if folks are using generators or other means of kind of getting electricity or energy back online, we can see an increase in carbon monoxide poisoning. So after a particularly bad storm in late 2013, around 400,000 homes in Michigan were without power, and they had 81 emergency department visits related to carbon monoxide as a result. So, you know, the connections may not be a direct line, but as we see increasing incidents of these extreme storms that lead to other impacts and behaviors for folks to try to get through, we can have kind of collateral impacts in terms of things like carbon monoxide poisoning. Going along a little further with infectious disease, waterborne pathogens, but also vector-borne diseases. Across the nation, we see 12 to 19 million cases of waterborne illness in the U.S., and more than 50% are associated with extreme rainfall. So it just kind of underscores that risk again. And in terms of vector-borne diseases, we can see that both drought and extreme precipitation can play a role. So for example, with West Nile virus, after a particularly hot and dry summer in Michigan, West Nile virus, which didn't arrive into the state until 2002, saw 202 cases and 17 deaths in just 1 year. That was 10 years later in 2012. So that both precipitation and heat can increase the habitat of these vectors, but drought also plays a role by disrupting the growth and replication rate of mosquitoes and speeding their development rate. So then that increases the population size. Drought also impacts the behavior of mosquitoes by pushing them to find other water sources, such as pools or puddles in yards, or just places where they may come into greater contact with humans and spread the disease. So more of kind of micro-vector changes as well as habitats. And then one other that's, again, pertinent to us in California is, it's called valley fever, the coccidioides immitis, make sure I get that right, which is a respiratory disease spread on spores that are carried on dust. And so as we've been experiencing our drought, again, we have these very dry, hot, dusty conditions, especially in our Central Valley, our main agricultural area. And a lot of the counties and towns in that area have seen increases in this disease, in valley fever. And then, I'm sorry, these aren't super clear maps, but this just shows the habitat. So not just mosquitoes, but of course ticks in the Midwest and other areas are a huge concern. So the tick risk, the disease carrying ticks first arrived in the state in 1992, but they've been found, they're now statewide and have been since 2013. And so they reported 165 cases in 2013, and those are expected to keep rising. Okay, so last on that priority list for Michigan, and a huge one for all places, is food security and nutrition. And I know that this is also a specific track for your fellowship program, so particularly pertinent. As Linda mentioned earlier, our industrial agricultural practices are a driving force of climate change, and then also our food systems suffer greater risks because of it. And so if we take into account fertilizer, refrigeration, transportation, land use changes like soil depletion and deforestation, we actually can account for 1/3 of all U.S. greenhouse gas emissions. And then we have additional emissions from food waste. So methane, which Linda mentioned previously, which is emitted by livestock, is also emitted by rotting food in our landfills. And in the U.S., we waste about 40% of our food. And at the same time, the average meal has ingredients that come from about 5 different countries. So if you think of emissions on the front end to get all of that food to the table, and then emissions on the back end as we toss it in the garbage, it's a pretty significant impact. So if we think, we'll get to solutions later, but if we even just think of food waste and local, procurement practices, we can make a big difference. So at the same time, we have huge issues around food insecurity. There's about almost 50 million people across the country who are food insecure. In Michigan, it's about 14% of the state's population. So I think that puts it at just over 1.2, 1.3 million. And so, that's obviously a huge concern for all states that are grappling with this. And food security is really defined as not just enough food, but enough healthy food. So an abundance of high calorie, low nutrient food can also be considered food insecurity. So some of the impacts of climate change, as I mentioned before, extreme heat can severely damage or even kill off crop yields. Also, higher CO2 content in the air can decrease the nutrient value of some crops, particularly I think sorghums and barley, and can kind of, can decrease that nutrient content. We also have, as we mentioned, livestock death and also fish yields. So I think 2 seasons ago in California, we actually didn't have our crab season. Our fishermen couldn't go out and harvest the crab, which not only meant lower availability of that food, but also had economic impacts for those folks. Shellfish toxins rise with algal blooms, so again impacts the availability and ability to harvest those. And then of course we see rising food prices as a result, water shortages linked to drought. And then as climate change impacts the vectors that we see, we may also begin to see higher uses of herbicides and pesticides, which also I know you're also covering toxics in your fellowship, so as you know, those have a huge impact on health. And for ourselves in California with our drought, those seep into our groundwater supply, and then as we are pumping out the groundwater to get folks through the drought, it increases their exposure. Let's see. Okay, so a few other impacts that I'm going to go through a little more briefly. Mental health we discussed because it's really weaved throughout every one of these other climate change impacts. There is research showing that climate change is having an impact on the mental health of folks, even if they are not directly experiencing the climate change impacts. But even just our exposure to stories of extreme weather, heat waves, the drought, etc., is causing higher, negative mental health effects in the population at large. We can also think again about economic stress and anxiety, floods or wildfires or anything that would threaten property damage and displacement. Also has those other effects on economic health. So displacement, trauma, PTSD are common with some of these climate change impacts. And then for anyone who's a provider, you know that with your patients, chronic disease management brings its own host of mental health concerns. And so anytime there are complications or disruptions to that, it can have an impact on your mental health. Again, our coping strategies to have better, more positive health are also impacted if we can't go outside to exercise or if we can't get good, nutritious food, which are both important for having good mental health. And then, as I mentioned before, our first responders, our public safety officials are at particular risk in our extreme weather situations, or even in situations where food availability or water availability might cause, unrest in an area. Pregnant women and children, in terms of a developmental standpoint, are particularly at risk, even though we know pregnancy is also a time of enormous resilience, and children are also incredibly resilient. They are just at greater risk. And then, of course, those with pre-existing mental illness are also at risk. So I've mentioned the California drought a few times, and there isn't a lot more that I haven't covered on this slide in terms of risks, perhaps with the exception of migration and conflict. So, you know, one of the largest migrations in U.S. history resulted from drought with the Dust Bowl, and caused entire communities to kind of move west in search of work and farm work. There's also been research showing, kind of looking at the link between climate change and the drought in Syria and other regions in the Middle East, and how that may have played a role in, you know, famine and then migration into the more urban centers, and then causing civil unrest from kind of the mass influx of folks. Wildfires, again, there's a lot to think about in terms of property loss, direct injury, burns and death, our emergency response systems and how they're put at risk, water supply issues. We had a wildfire out in Yosemite, which is a couple hundred miles away from San Francisco, but the reservoir that supplies the city of San Francisco with its water was, you know, near the wildfire. And so despite being hundreds of miles away, the risks to the water supply for the folks in San Francisco was high during that fire. And then I mentioned, again, the soot and both the chemicals that we use to fight these fires pose risks for respiratory disease and heart disease. And then again, really just specific to us here in California, we think a lot about sea level rise, flooding and erosion, also the contamination of freshwater areas with salt water and how that threatens drinking supply, irrigation stores, and also fish and wildlife habitats. So that's something we have to be considering. Also, there's about 50 billion in property at risk in California for a 100-year flood, and so and about 250,000 people. And then I think by the end of the century, that number doubles to almost 500,000 people and $100 billion in property, which includes you know, a lot of our tourist industries and communities. So we have to think about a lot of that. And then if we think from also an equity and a vulnerable population standpoint in the U.S., we see that our first climate refugees, so to speak, in our own country are coastal Native American communities whose lands, especially down in near Louisiana, are basically disappearing, and the federal government is spending a lot of money to relocate entire communities, also in Alaska, who, as their homes are slowly disappearing as a result of sea level rise. So that was a lot of impacts, and they are all interconnected, as you saw. But even as we think about all these impacts, we always want to keep equity and health equity at the center of the conversation. So I'm going to hand it back to Linda to say a little more about that. But you know, just keeping in mind that our living conditions, the social determinants of health, the social, economic, physical conditions under which we live, we know that those have a greater impact on our health than, say, our genetics or our access, or, you know, our quality of health care. And so if we're really going to solve the climate change crisis, it demands that we come at it from a health equity standpoint. So with that, I will hand it back to you, Linda.
Great. Thanks. Can you just go on to the next slide? So as Catherine just mentioned, our living conditions really drive health outcomes in populations. And we all know that there's very, very big differences in those living conditions among different neighborhoods. Some neighborhoods have great sidewalks and bike trails and access to public transit, and others really force people into spending long hours commuting in the freeway or living next to busy roadways that we know are associated with adverse health outcomes. Some neighborhoods have great farmers markets, and others are filled with liquor stores and fast food outlets. And we know that those are associated with, those neighborhoods with more outlets of liquor stores and fast food facilities are associated with higher rates of obesity and diabetes. Some playgrounds are beautiful and others are, sort of the concrete jungle. And working conditions vary. So people that work in, contingent jobs or as farm workers or whatever have, lower wages that impact whether or not they and their families are living in poverty, and also just different kinds of occupational health and safety risks next. So the question is, why does that have something to do with climate change? And if you look at the literature on what makes individuals or communities vulnerable to climate change, or on the flip side, what makes them more likely to be able to thrive even in the context of climate change, there's lots of things, but many of them relate to the same things that I was just talking about. We know that, as Catherine mentioned, people that have certain chronic illnesses are much more likely to experience heat stress or other adverse health outcomes associated with heat exposure. And we know that people, as I just mentioned, that, don't have access to a gym or don't have access to healthy, affordable foods are more likely to have those same health conditions that increase vulnerability to heat. We know that some people are more dependent on government function than others. So if there isn't adequate public transit, they can't evacuate before a hurricane or a storm. We saw that both in Superstorm Sandy and in Hurricane Katrina, where the people that stayed behind were largely low-income people who didn't have good access to transportation options, or weren't able to, were more isolated people who didn't have someplace to go. Food systems I talked about, but we also know that food insecurity is greatest in low-income populations, and as Catherine mentioned, food prices are likely to rise in the face of the impact of climate change on crop yields and animal and fish production. And when food prices rise, food insecurity rises, and food insecurity is associated with higher rates of chronic illness. So, working conditions, people that work outdoors are much more likely to have high risks of heat illness, particularly those that are doing jobs that require heavy labor. People that live near freeways or near, or in fence-line communities next to polluting industries like oil refineries are more likely to already have higher rates of asthma and cardiovascular disease from that air pollution that they're exposed to. So when rising temperatures increase ozone levels, they're even at greater risk. Next slide. So what we see is that living conditions increase the risks of climate impacts, and some pre-existing other environmental impacts, like living in a more polluted area or living in an area that already has water contamination where the drought just further concentrates those contaminants, increases vulnerability to climate change. And health inequities and pre-existing health conditions increased vulnerability to climate change. So all those things basically mean that climate change disproportionately impacts low-income people, people of color, people with pre-existing health conditions, creating, next slide, what colleagues of ours here in California, Rachel Morello-Frosch and Manuel Pasteur, have termed the climate gap. The elderly are also especially vulnerable to heat. And, you know, these are just pictures basically illustrating what I just said on the prior slide. Next. So the same reasons for the disproportionate impact on people on low-income communities and people, communities of color, you know, the impacts of living conditions and access to transportation and access to healthy food, those same things actually also create these huge potential health co-benefits from climate solutions. When we think about what reduces greenhouse gas emissions in critical systems, we see that if we implement solutions that reduce greenhouse gases, we also reduce many of the health risks that largely drive our chronic disease epidemic and drive health inequities in every community across the country. So, you know, a great way to reduce greenhouse gas emissions from transportation is to get people to drive less and use transit, walking, and biking more. And the physical activity associated with active transportation and transit use significantly reduces heart disease, diabetes, obesity, cancers, osteoporosis, and improves social cohesion and a sense of mental emotional well-being. Similarly, if we switch from our dirty, polluting fossil fuels to clean and renewable energy sources like wind and solar, we reduce all of the adverse impacts associated with the combustion of fossil fuels, and we reduce respiratory disease, cardiovascular disease, and adverse birth outcomes. If we create local sustainable food systems, we can increase food security, and by encouraging less meat consumption and a more plant-based diet, reduce heart disease, reduce the antibiotic resistance that goes with industrialized meat production, and reduce pesticide exposures. And finally, some climate change solutions have health co-benefits and help people adapt to our changing climate. So we know that planting trees and increasing greening in urban neighborhoods reduces heat illness risk, but it also reduces air pollution, reduces the risk of flooding, reduces carbon dioxide because trees capture carbon, and increases the availability of spaces for people to be physically active with all of those attendant benefits. So for me, this is sort of, since I've spent much of my career doing chronic disease prevention in local and state health departments, this is like the sweet spot and what gives me optimism around climate change. People every place value health, and when they really understand that the solutions that people are talking about to address climate change are also solutions that are going to create healthier places for their kids to grow up in, that's when I think we really have a much better hope of really moving communities toward addressing climate change, because we get these multiple co-benefits. Catherine.
Great. Thanks, Linda. So I'm going to just close us out a little bit by talking a little bit about the role of health professionals, and for our project specifically, we have been working with physicians and particularly physicians that either represent or serve low-income communities or communities of color as those sort of more vulnerable populations. And in our work, we've drawn on some research out of the George Mason University Center for Climate Change Communications, which is also another great place with really excellent resources. And they've surveyed a number of groups of physician groups, such as the American Academy of Allergists and thoracic physicians, the National Medical Association, which is the National Association of African American Physicians. And in their research, they find that the vast majority believe that climate change is relevant to patient care, and that they are already seeing the effects of climate change in their population. So this slide has results specific to the National Medical Association and where they see climate change impacting their population. And again, this group of physicians being somewhat overrepresentative in terms of family practice and seeing as compared to the other more specialized groups that were surveyed, are seeing, you know, a very general population and a wide range of effects. And so thinking about chronic disease issues with air pollution, allergy symptoms, heat-related illness, vector-borne disease, and then food and water illness, along with extreme weather and wildfires. All of those numbers being, you know, above half of those physicians seeing those impacts. You know, we know that this is a population that is well situated in terms of physicians and other healthcare providers to, as trusted messengers, both with patients, but then also in their communities and with the public. They're well situated to raise their voices and contribute to solutions. And so I know you all are a very interdisciplinary group, and you know, a lot of what we think about with our physicians we think is very applicable to all healthcare providers. And so in thinking about just the health frame alone, let alone who is giving the message, or regardless of who's giving the message, we know that that frame is one that elicits a lot of support for climate action. We work with policymakers at the state capitol in California, and we hear a lot that, you know, they really value that health provider voice, that it lends a lot of credibility to their policy solutions. You know, we think about the health code benefits and community empowerment. Health is really central to community well-being and community cohesion. Again, we talked about the trusted, credible messenger role that health providers play. And then, you know, health and public health specifically, you know, really works in and with vulnerable communities. So community partnership is key. And, you know, we know that the health voice alone isn't enough, is not totally sufficient. It has to be in true partnership, especially when we're working from an equity standpoint. Having active participation, active engagement, and leadership with communities is really critical to making this role successful. We mentioned at the very beginning the physician's guide that we developed. That was actually the curriculum we created for this project, specifically that we do our Provider Champions project, and we're in the process of expanding that for really any health professionals to be able to use, not just, you know, taking that provider or physician role, and then also thinking about how we can apply that to the kind of comprehensive role of local and state health departments in a public health provider setting and role. So we encourage right now our physicians, but all health providers, to use the information in that guide and in that curriculum and in our trainings in a variety of ways. And, you know, they span the individual. So you yourself can eat less meat, especially red meat coming from cattle, which give off a lot of methane emissions. You yourself can walk, bike, and use transit. You yourself can you switch to clean energy and energy efficiency. But really, we, you know, as Linda talked about, those co-benefit strategies really happen at the community and policy level. And so, you know, whether it's the community of your hospital, your institution, your clinic, you know, greening your clinic, greening your hospital, organizations like Healthcare Without Harm and others are really leading the charge in not only making our clinical settings themselves healthier and more healthful places, but reducing the impact of those systems on our climate. Doing media advocacy in the form of op-eds and letters to the editor. And you can really draw climate change to anything. We recently did an op-ed in The Hill with the heads of the National Medical Association and the National Hispanic Medical Association that talked about why advocating for the Affordable Care Act and affordable quality health care for all is even more imperative given the climate reality we're facing. So there's always an opportunity to bring up climate change action. TV and radio interviews, we've done a few on Spanish-speaking radio, Hmong television, just trying to get the message out to every community. And then, of course, educating your representatives, so doing education visits with policymakers in your district or at the Capitol, and just letting them know why taking action on climate change is so important, and you know what expertise you can lend from a health and clinical standpoint for that, weighing in, giving expert opinion on policies and things like that. Of course, being mindful of your own restrictions around lobbying or advocacy, but as a private citizen, there's a lot that you can do. So those kind of, you know, on that right-hand side, kind of looking at more of the systems level, but also at the community level, thinking about what's happening at your city council in terms of zoning decisions, or, you know, there are a lot of local food policy councils that are taking action to make sure that the food systems in the community are looking and taking into account not only, again, the climate change impacts, but and practices, so procurement and transportation and growing, but also the equity ramifications of the food systems. And then finally, moving kind of back down, you know, really educating your patients and thinking about, you know, what is the care protocol for this person who has diabetes or another chronic illness? What is the situation for this child who has asthma and lives maybe in multi-unit housing and may not have, you know, the best air filtration because the building is old, or may have other exposure risks for exacerbations and things like that. So there are a number of ways and multiple levels that health providers can be involved, and these are just some of the ones that we work through in our own project. And so this is just an example of, this is one of our physicians doing an interview for Hmong television. The article in the lower left on kidney health was a piece that one of our physicians did about that new sort of class of, or rising incidence of chronic kidney disease that we've seen. And then medical society resolutions have also been a key way just to increase, again, that provider and health professional voice on the issue. So that, I thought I had one more slide. I apologize with resources, but I will send a list tomorrow that includes the link for our physician's guide, as well as some of the other resources that might be helpful if you don't have them already for Michigan. So Michigan is a BRACE state as well. That's the CDC program. It stands for Building Resilience Against Climate Effects. It's 16 states and 2 cities have received funding to kind of anticipate and plan for climate change effects, and Michigan is one of them. Again, the resources, the health profile, and then also the strategic plan and adaptation. And then a couple of our resources that I can pass along. The well, nationally, the Global Climate Change Research Program has the National Climate Assessment that came out last year. Again, the American Lung Association has their State of the Air report. We have our physician's guide, and then we also have a piece that focuses a little more specifically and closely on equity and goes into some of the framework that Linda showed part of. So I'm sorry again that I don't have that slide in here, but I will make sure to pass those on to Mara. And that does it for us. And I guess, Mara, I'll hand it back to you and open up for questions.
Great. Thank you so much. So we have had a couple questions come in while you were presenting, but also for everyone that is attending this webinar, if you have any questions that you're thinking about now, feel free to either raise your hand or chat them out. We'll be sure that they're covered. But just for starters, this is specifically pertaining to one of the slides that Dr. Rudolph had, but this might be a question for both of you. It was mentioned that adverse birth outcomes are related to climate change. Could you be a little bit more specific and maybe give a couple examples of what exactly it was that you were referring to when you mentioned that?
I'll give two examples. One is that we know that adverse reproductive outcomes are associated with air pollution, and as Catherine mentioned, we know that air pollution will rise as heat rises because of rising ozone and probably rising particulate matter levels. And then another example is Zika virus, where climate change didn't cause Zika, but climate change has allowed the emergence of mosquito-borne illness in new areas, and also facilitated the rise in mosquito populations through its other impacts. So I had the opportunity to actually be in Brazil just a month before the Zika outbreak there, and all over Sao Paulo was in the midst of the worst drought in its history. And all over Sao Paulo, one way that people were coping with the drought, because they literally didn't have tap water for many hours each day, was whenever the tap water came on or when they could get a water truck to come to their neighborhood, they would fill up any container they had available with water when they could get water. So all over the place, you would just see these buckets and rain barrels and all sorts of containers with water without having the kind of covering on them that you would want to reduce mosquito infestations. And people in Brazil that work on climate change feel like that probably helped the spread of Zika virus. So all of these things are complicated, but those are two examples on the reproductive outcomes.
And I can just say a little more, that we actually have a sheet in our guide that focuses specifically on pregnant women, and it's mostly information taken from the National Climate Assessment, and we look at, they talk about heat-related impacts, so extreme heat events particularly have been associated with preterm birth, low birth weight, and infant mortality. They look at just, in general, nutrition for pregnant women, access to safe and reliable water sources, and there was also some research looking at flood exposure associated with poor birth outcomes after both Hurricane Katrina and floods from about, I think, almost 20 years ago now in North Dakota, in 1997 flooding in North Dakota. So, in terms of exposure to toxins, mold, safe food and water, there's also some risk there. And then, Linda, I think you may have to back me up on this, but I think we've also in the past talked about contaminants from coal-fired power plants, and particularly mercury emissions, and thinking about how that impacts pregnant women. Of course, mercury exposure being incredibly dangerous during that time.
So that's a good example of how addressing the causes of climate change brings other health co-benefits.
Mm-hmm.
Great, thank you. Another question that we have, so recently, I believe it was about a month ago, there was a video that was going around on the internet from Popular Science, and it was showing, you know, in the future, all the different climate change related issues that different regions were going to be experiencing. And at the end of the video, kind of like the take home point was everyone should move to Michigan. So one of the issues that I think that a lot of people run into here in the state is that we're not seeing as many effects, or we're not seeing as many extreme effects pertaining to climate change as other regions and other states. Do you have any specific tips or ideas of how messaging could work when you're you know, trying to get the point across to people who aren't really feeling any of the real effects, whereas like in California, you've been dealing with, you know, drought and wildfires that we're not really seeing here?
Well, we actually have been working with local health department in Michigan that's just done a survey in their community to look at how some of the 20,000 people who were displaced from their homes in an extreme precipitation event in 2014 are doing 2 years later. Macomb County, Michigan. And that's Warren. I don't know if any of you are from around there. So Michigan's definitely experiencing changes in precipitation patterns. And as Catherine pointed out, many parts of Michigan are experiencing increases in the number of extreme heat days and the number of extreme weather events, and also a decrease in cooling hours, which impacts agriculture a lot. So, you know, I'm not familiar with Michigan agriculture that much, but in California, the decrease in chill hours that's accompanying temperature rises means that, you know, people are forecasting very, very significant declines in cherries. And that maybe, you know, I like to eat cherries. So I don't know what the impacts are in agriculture there, but I'm certain that you are experiencing some of them as well. So heat and flooding, and then the changes in vector-borne disease. I don't think Catherine, I'm not sure, I can't remember now if Catherine showed this slide showing how much of an increase in West Nile virus and other vector-borne illnesses there's been in Michigan, but that's happening now, and it's at least in part related to warming weather and changes in precipitation.
Great, thank you. Yeah, I think that really helps make it clear that there is more of a sense of urgency, whereas a lot of, you know, especially when it comes to the legislature, a lot of the legislators that we discuss, you know, climate change with, when you do use the words climate change, they see it as something that's a little bit farther out into the future. So bringing it back to what's happening now. Perfect, thank you. And oh, actually one of our fellows did chime in and they mentioned that it is the cherry and fruit tree crops that are most affected here in the state when it comes to agriculture. But other than that, we don't have any other questions right now. I'm going to leave it open for just another minute to see if anyone else has any questions. But in the meantime, I just want to thank our presenters so much for taking the time to speak with us today. Oh, and actually, oh, go ahead.
I was going to just say it's a pleasure, and we're very interested in this whole health leaders training. So we appreciate being able to be a small part of it.
Oh, perfect. And actually, we had another question just come through. One of the questions has to do with how is climate change research conducted?
That's a really big question, and neither Catherine nor I are researchers, but the researchers that are doing, you know, the basic climate science research basically are putting together information from temperature and, you know, from temperature and humidity and rainfall and amount of snowpack and, literally thousands of different endpoints, and using very, very complex computer modeling, looking at trends over many years and changes in these different measures that we know are associated with climate change to look at what the impacts are. And then similarly on the health side, people are using a variety of different methods, ranging from epidemiology and, measuring and just the basic surveillance that we conduct in public health to try and figure out how these different things are associated with different health impacts. A lot of the basic science on climate change really derives from the physics of what happens in the atmosphere when you add these greenhouse gases. So people can forecast what will happen with different levels of greenhouse gases because it's just a basic, physics relationship between the concentration and the temperature effects. I don't know if that answers your question, but it's a complicated one.
Yeah, and I would just add, it's telling that both Linda and I kind of paused and then laughed, not because it's a hoax or not because it's cloudy or not because, but it is incredibly complex. And the Intergovernmental Panel on Climate Change is really the trusted, is the place where a lot of this research is happening. And to read through their documents, it's an undertaking in itself. There's the different, the various models. So there's the evolution of different models. Then there's the different scenarios. So what happens if the planet warms by 4 degrees? What if we can keep it under 1.5? And then the health projections. So even the Michigan report that I referenced uses, looks at different health scenarios under those different models and looks at combined models. So the one that looked at the forecast for extreme heat days from 2041 to 2070 for the state of Michigan was a combined model projection, but the report also shows the projections under the other models. So there's a lot of, looking at best case scenario, looking at worst case scenario, combining and synthesizing. So, for me, the takeaway from that is that there is no scenario where we can just say, we can just ignore this. Everything that's kind of being distilled down into, what do policy leaders, what do the general public, what do health professionals need, what information do we need to use to make decisions, is not, we're not working off the worst case and we're not working off the best case. And if we were, it's still very, very critical. And there isn't a great outlook. The need for action is great.
Can I add something?
Mm-hmm.
A lot of healthcare providers and health professionals are leery of talking about the impacts of climate change on health in their communities or with their colleagues because they feel like they don't really understand climate science. And I think it's just important to remember that 97% of scientists that work in this arena believe that, based on the evidence, that climate change is happening now. It's happening faster than scientists anticipated a decade ago, and that our human activities are the biggest contributor to climate change. So I kind of feel like the climate scientists in this case are the experts on whether climate change is happening and why. And my job as a health professional is to help people understand what that means from a health perspective. I don't need to be a climate scientist to talk about the impacts of climate change on health, especially when we can see those impacts happening. And it's sort of like a primary care provider telling a patient, I know that you have really, uncontrolled diabetes, and so I'm going to refer you to a specialist that really understands that better. I can rely on the expertise of others without having all of the climate scientist expertise myself to understand that there's a problem that we need to address to promote better health in our communities.
Yeah, I would agree. That's a great point, and one that you, Linda, continue to teach me since sort of day one in this role and wading further into climate change and health impacts. My career in it is relatively short compared to Linda's experience, and that I can speak directly to that same tension, that desire to be able to fully understand or know everything about it, and to kind of realize that that role or that trust in that literature and that science is there. And I can speak from what I know, which is as a health provider and specifically as a nurse with communities and patients. So, yeah.
Great. And so I think we have time for one more question. It actually came through when you were discussing a little bit more about the climate change research and how it's conducted. This question asks if you could speak more specifically about what a home assessment would look like, or what might be included in something like that.
Well, it obviously depends in part on who the patient is and what the issues are. And what the setting is. But I can give you an example of something that public health nurses in Fresno, California did as a project, and now they're incorporating into their standard practice. Fresno's a hot place, and so when the public health nurses went out to do home visits, particularly with elderly people or with very young children in the household, they did a home assessment that looked at their preparedness to deal with heat. So they looked at, do they have air conditioning or do they have a fan? They asked them, does it work? They asked them if they ever needed help with paying their electricity bills, so that they would know whether they need referrals to the LIHEAP, Low Income Heating and Energy Assistance Program, so that because we know that poor people sometimes won't turn on their air conditioner even when it's really hot because they're afraid of having too high an electricity bill. And totally parenthetically, LIHEAP is one of the programs that's on the chopping block right now at the federal level. And they looked at, they asked people, did they know where their nearest cooling center was, and did they have a way that they could get to a cooling center, and also gave them some other basic information about how to prepare for a heat emergency. In San Diego, the San Diego Environmental Health Coalition worked with a local community clinic and trained some of their promotoras who were doing home visits to walk through homes with clients and talk to them about energy efficiency and what they could do to improve energy efficiency and thus save money on their electricity bills. Just, things like light bulbs and, other simple energy efficiency things that people could do. And then link that to how energy efficiency reduces our overall electricity use, and then talking about different electricity sources. So I think there's lots of different things that we could do. nurses in Tulare County actually went out and did community surveys to look at whether or not people were having challenges during the drought with actually having adequate drinking water, and then referring them to appropriate community resources where they could get bottled water for free, or where there was, I mean, at some places they actually had to set up community showers because people didn't have running water. So I think depending on the where and the what is going on in a community and what the particular risks are, you can look at all those things. Like in Macomb, I think they're pretty interested now in, whether or not people have moisture-related problems like mold in their homes after the flooding, because we know that mold is associated with a variety of health problems. So, in an area that's prone to flooding, you might want to look in basements and see if there's evidence of water, or look at whether there's mold and stuff like that. So hopefully that gives you some ideas.
And I would just add, I know we're coming up on time, I just would add that keeping, again, considerations around equity, with those home assessments is really important. So in a project that's not related to climate change, but in which, again, public health nurses who do in-home asthma management, we're going in to look and assess apartments, particularly for risks, so mold, leaky faucets, things that are going to, contribute to asthma exacerbation, but that may also be code violations, or you may have folks who the residents or tenants, or who they themselves may be fearful of speaking up about for fear of eviction or some other issue, which is a huge risk, especially in our housing market in the Bay Area. And so having some mechanism, which of course requires a little more work and a little more resources, but to have some liaison or link to the code enforcement department in your community, and just kind of having a team approach, kind of a multi-department team approach. So to make sure that, again, those who are most at risk, who may have other concerns, socioeconomic vulnerabilities that put them at risk and make them fearful of losing their house, and that those things don't stand in the way of mitigating some of these issues. So that's one thing to think about for any assessment, a home assessment, is how is the public health department involved, or how is the health provider involved, and what are their community organizations, or I think that particular project also involved a tenants' rights group, might be helpful in a situation like that.
Okay. Well, thank you so much again. We are so appreciative of having you both on to present to our group today. And with that, we just have a couple last-minute housekeeping pieces. So the evaluation, it is required for all Health Leader Fellows to complete the evaluation form. It's also required for any of our attendees who are looking for continuing education credits. So I just sent out the link for the survey. The evaluation, we like to have that in at least 1 week after the webinar, so you have 1 week to complete it. However, it's pretty short. It's just a quick summary of objectives and then also giving some feedback. So if you have any questions about that, please feel free to contact me. We will also be sending out the recording of the webinar tomorrow, so you are able to review it and look at it as many times as you'd like. And lastly, just a quick reminder, our next webinar is our media training, which it was actually great that it was mentioned in the presentation, media advocacy. We'll be joined by Sam Inglot from Progress, Michigan, and that training is scheduled for next month on Tuesday, May 16th from noon to 1. And with that, once again, thank you so much to our presenters and for all the attendees today, and have a great evening.
Okay.